Hi, in this video we're looking at cholesterol in our blood, and we'll see that cholesterol is transported in two major forms, LDL and HDL. Now the reason why cholesterol needs to be packaged into special particles is because it is a lipid and thus by itself not soluble in water. So it's packaged into two particles, one of which is low-density lipoprotein, or LDL, which carries about 2/3 of the cholesterol in the bloodstream, and the other particle is called HDL for high-density lipoproteins. Now, traditionally, LDL cholesterol was considered to be the bad cholesterol. It is believed to contribute to coronary heart disease, or CHD, whereas traditionally, HDL was considered the good cholesterol. That means that having high HDL levels was considered to be protective. Now let's look at the evidence that led to that idea, and we'll also see that some of that evidence needs some re-evaluation. Now, let's first look at the different types of evidence that link LDL to coronary heart disease. Now, the first level of evidence is epidemiological. Now, what does that mean? People have observed that having LDL cholesterol levels increases your risk of heart disease. So if you screen a lot of people, those people with high LDL levels have a higher chance of developing coronary heart disease. That's one. The second level of evidence is genetic. Now, what does that mean? Now, some people have very high LDL levels because they have a genetic defect, and those people have a very high chance of developing coronary heart disease. There are also some people that have a very low LDL cholesterol level because they have another type of genetic defect, and they have a very low chance of developing heart disease. Now, what about the third level? Pharmacological. Now, when you pharmacologically, that is through drug use, lower your LDL cholesterol level, your chance of developing a heart attack goes down. And of course, we know about these drugs. They're called statins. So from a pharmacological point of view, we know that LDL promotes heart disease. And the final level of evidence is what we call mechanistic. We have a mechanism, we have an idea how biologically LDL can contribute to heart disease, because what happens is that LDL is taken up by special cells called macrophages in the wall of arteries, and these macrophages become foam cell and accumulate and form that atherosclerotic plaque that is at the root of coronary heart disease. So there is solid evidence that LDL cholesterol really deserves that label as bad cholesterol. Now, what about HDL cholesterol? Does it deserve to be called good cholesterol? Well, it used to be yes, but we need to consider some of the more recent data, and they suggest that perhaps this is not entirely true. Now, first of all, let's look at the epidemiological evidence. And there's no doubt about it that having a high HDL cholesterol is good for you. People that have high HDL cholesterol levels are at lower risk for developing heart disease. Now, let's look at the second level of evidence, genetic evidence. Now, the genetic evidence is not very conclusive in the sense that people that have high HDL levels do not necessarily have a lower chance of developing heart disease. So it is not really conclusive at this point. What about pharmacological? Now, this is very interesting because people have been trying to develop drugs that raise your HDL cholesterol with the idea that having more HDL cholesterol would be good. So there are certain drugs that very effectively raise your HDL cholesterol. However, it turned out that these drugs don't lower your risk of heart disease, they actually increased it. So this finding completely turned around the whole idea about HDL being protective against heart disease. And we're now in a situation where we're not sure. So perhaps the best conclusion is that having a high HDL cholesterol level is good for you. It protects against heart disease. But raising your HDL level by any means, whether perhaps food and drug, may not be a good idea. Now, finally, mechanistic evidence. There's some evidence about how HDL could be protective. The trouble with mechanistic evidence is always, you can always find a mechanism that supports your overall theory. At this point, we can picture a role of HDL as a transporter, taking the cholesterol back from the periphery, taking it back from the atherosclerotic plaque and bringing it back to the liver. However, we need to put it into the overall context, and that context says that at this point we cannot definitely conclude that HDL is protective, while we can definitely conclude that LDL cholesterol raises your chance of heart disease.